All right, I'll be presenting on meeting the intersection between cultural competence and health disparities, being that it is so multidisciplinary with the diversity in communities today. So a bit about me is that I'm a rising junior at the North Brunswick Township High School in New Jersey, and a few of my research interests are genetics, biochemistry, neuroscience, biopsychology, and mental health. And so to supplement all of that and merge all of my interests, I work with a lot of different mental health and medical-oriented startups, organizations, and projects, some of which include Medicine Encompassed, the New York Academy of Sciences, Juve Consulting for a lot of like interdisciplinary marketing, and some of my in-school extracurriculars include DECA FBLA Push, which is a student group that presents to young student audiences about pressing topics in the world today, and Radar Academics, which is basically like the US National Chemistry Olympiad, as well as the New Jersey Science League. So first we want to talk about what exactly cultural competence is and the importance of its characteristics. And so I've broken the principles down into what the tenet consists of: culture and competence. And though culture is not just limited to the three that I've presented, these are kind of the principles that a lot of people tend to get at. So first we have linguistics, which is the comprehension of languages adopted by many certain cultures and ethnic groups globally. You have attitudes and behavioral congruence, which is basically how some groups' reactions align with particular events, stances, and their approach towards certain situations. We also have thoughts and preconceived notions. So we must consider why one's upbringing, their mindset towards an event, and why their customs are formed in such manners. Obviously, competence in this kind of setting factors in abilities to understand and adapt to an individual's needs based on their functions and behaviors, which of course are distinct to many cultural groups worldwide. And the diagram on the right also demonstrates the four principles that are kind of needed to be integrated in developing cultural competence. So I like to use the analogy that not one patient may possess the same values as another patient. And so this is where cultural competence also comes to play. We want to consider subjective treatment being more beneficial over objective treatment. And as shown to the right, I also like the principle that medicine is more than treatment, because it also requires respecting cultural differences and being sensitive to those kinds of matters. We want all health organizations and medical professionals to take the following into account when administering treatment. We must obviously acknowledge that all patients are diverse in numerous components, which include but aren't limited to physically, their background, linguistics, socioeconomic status, and more. We want to identify the many disparities and the ways we can respond to these differences appropriately. And so we want to tailor this treatment to the given conditions, which is why subjective treatment is much better than objective treatment. We want to institutionalize one's community structure, policy, and their set of values that may require one's treatment to be more effective over the other. And so we want to consider the whys and the why nots when considering the interconnections between the diverse components of a patient. So some statistics we want to bring into light is that an estimated 50% of the US population is actually said to consist of minorities by the year 2050, which is a very significant increase to what it currently is today. And minorities are statistically shown to receive a lesser quality of health treatment compared to their counterparts. And so this is where cultural competence obviously needs to come through more. There's a very apparent lack of underrepresentation in the healthcare force. And so patients of a certain background may actually feel less inclined to seek proper treatment. And this is really just due to the fact that they fear that they'll be comprehended improperly. And they also fear that there is a failure to resonate their intentions and beliefs with their healthcare provider. An alarming 53% of health organizations only had about 0 to 1 medical services that promoted ways to bridge disparities between medical administration and culture. And considering that there are over 20 possibilities to do this, as I said, this statistic is actually quite alarming. And we also want to consider that lower rates of social determinants of healthcare among minorities are also proposed to play a role in receiving these kinds of services, which are also caused by similar factors. Some critical factors we also want to take into account is socioeconomic status, which results in broken appointments. So this also concerns individuals that may fall uninsured, which may lead to their declined healthcare benefits. We also want to consider personal, religious, and shared experiences, which kind of encompass like traumatic events or personal circumstances that basically alter their course of values, obviously we have linguistic barriers and not being understood properly when it comes to requests, which can also therefore result in a very lacking treatment. We also have the unfamiliarity with the modern healthcare system. So some people may feel hesitant to seek treatment because they don't know how it'll affect them or how it works or how exactly it aligns with their goals. There is also a very evident underrepresentation of different ethnic groups and clinical studies when it comes to treatment or drugs. So we can't exactly extrapolate how these results can be like generalized properly without possible disparities arising in the process. And lastly, we have structural and gender and sex differences, which can be like biological. So like dosages, medical equipment, and corresponding bodily differences can play a role. Even though they may seem minor at first, they can often induce very significant effects. So some benefit areas in practice and society ranges from business, healthcare-wise, and social-wise. In the business aspect, we can see that it benefits the company itself and increased market shares and more effective services being brought out, which can captivate more diverse populations, which in turn improves hospitality and treatment. From a healthcare perspective, we can see that there is more consideration of the patient's backgrounds and conditions, which results in more efficacy. This also goes hand in hand with preventive care because we can factor in the patient's health choices, habits, and processes more. Social-wise, we can see that there is a very evident increase in the trust among patients, fostering inclusions among diverse communities, and getting more diversified perspectives. We know how to better assist the family and the patient itself emotionally, mentally, and physically. And there is more accountability being brought to the medical professional, which in turn also increases empathy and a sense of understanding. So with the importance of these culture-wise healthcare services, we want to adjust the way that services are being executed in order to cover all of the disparities in full when concerning gender, age, ethnicity, and social status. This also lessens the likelihood of marginalized communities receiving a statistically less amount of treatment. And this would increase equity overall and increase the tendency to seek proper treatment. And as medical professionals, we want to learn certain cultures like functions and behavior and carefully apply these patterns to healthcare settings and essentially understand the patient's perspective better. And also, practices can provide resources and materials that better educate providers about cultural competence and again, how to apply these to all of the patients that they encounter. With immigrant communities, this obviously plays a substantial role considering the background that they're from. And there, as I mentioned earlier, there is a very big lack of medical and healthcare research on diverse and minority populations. And this obviously would engender potential issues with how their treatment would affect their conditions going forward. This also brings the question, can results from trials truly be extrapolated or generalized to the full population if it isn't inclusive of multi-ethnic groups? This also fails to account for different symptoms in these underrepresented communities and populations, and it may actually result in the worsening of their health conditions. This also brings about indirect consequences such as their family life, their work-life balance, and the emotional and mental strain. This also does affect mental health because many patients will end up questioning their self-identity, which leads to steep declines in their esteem rates, their perception of oneself, and evaluating their self-worth as judged by the perception of others. And this is the case because a lot of immigrants and culturally diverse individuals may be hesitant when seeking medical services in their non-native country. It overall leaves them feeling severely misunderstood, leaving them to question the validity of their identity and if their differences are even being accepted by medical professionals. And it really just puts overall emotional and mental strain from this bias by medical professionals because they will likely feel that they are being refused the proper treatment that they really deserve. So in order to improve this cultural competence, we want to eradicate medical bias. We want to establish that balance between health and cultural literacy, and we want to discuss the variances in certain providers. A good abbreviation that we like to use when collecting data related to this is REAL, which stands for race, ethnicity, and language. And this is to identify any gaps that may not seem obvious at first in population statistics and tailoring services to represent the entire community as a whole. And overall, as listed as at the bottom, we just want to increase levels of community involvement, conduct regular measures on treatment efficacy among all social groups. We want to diversify work pipelines, prioritize cultural competence among the workforce, be open to diversity, equity, and inclusion efforts, and develop more appropriate management programs for this matter. And these are just some of the sources and references I used, and also including my acknowledgements and some of my contact information on my LinkedIn and my Instagram if you ever want to reach out to me.